This is the presentation for Team 5 at the University of Maryland Global Campus Healthcare Administration, Capstone. Today we will talk about transplantation service for the hemodialysis patient. Timely and efficient transplantation operation for senior patients is a growing challenge. Dialysis is the standard of treatment for patients with end-stage renal disease outside of a kidney transplant. Outpatient dialysis treatment plans is provided in the community. Patients who receive outpatient dialysis may need help with transportation to and from a dialysis center. Failure to receive needed dialysis treatment is life-threatening. A persistent lack of compliance on dialysis treatments hinders the ESRD patients from getting a kidney transplant. Hemodialysis is provided to ESRD patients in a hospital, at home, or at dialysis centers within a community. It is essential that these patients get the life-sustaining treatment they need. To provide quality treatment, ESRD patients require timely scheduled dialysis. They also need safe and dependable transportation to their dialysis treatment. Lack or delay in transportation services could lead many elderly patients to the emergency room. So this project examined elderly patients above the age of 65 who will require routine hemodialysis treatment. Thousands of individuals suffer from kidney disease in Maryland. 17.2% of Baltimore County's population of 65 and older live in poverty. Current market for transportation service to and from hemodialysis facilities is limited. First Choice Service will provide free services and reliable transportation to this specific population. Why does Baltimore County need transportation services? 1 in 4 Baltimore County residents will be senior citizens by 2020. The county lacks transportation services for patients who need transport to and from inpatient dialysis centers. Correction, not inpatient dialysis centers. Inpatient is hospital, but in-center dialysis. End-stage renal disease affects almost 750,000 people per year. Patients needing hemodialysis require dialysis 3 times a week, and it can range from 3 to 5 hours each visit. So the lack of a person or the person missing a dialysis appointment could result in increased hospitalization and also an increased mortality rate. We want to describe the circumstances underlying our project. Poverty is a barrier to access transportation. Baltimore County has a significant amount of its population in poverty. End-stage renal disease increases the need for kidney dialysis. Missing one treatment could land a patient in the emergency room for emergent dialysis. There is a lack of timely share ride cost in Baltimore County, which causes the delay in some patients getting treatment. Improving transportation services promotes health and well-being in Baltimore County residents. This project expands the opportunities to access care for low-income residents. Some commercial insurances, state and federally funded health insurances, do not consider transportation to in-center dialysis as an emergency, and they don't offer services for or non-emergency services for patients, what we call non-emergency transport services. They don't believe or deem that as medically necessary. And some health insurances do cover it, but then when you talk about Medicare, they don't cover those kinds of services. Medicaid in some instances will supply those services, as in the case of Vermont and some other states that, and it's up to the state really to supply those kinds of funds. The Maryland Medical Assistance Program covers non-emergency transportation services if one qualifies for it. The patient has to be low income. You have to have You have to have a need for it, of course, and you have to show that you don't have any other way to get to your appointments, and it certainly has to be signed off by a doctor. So who would this project serve? This project will serve senior citizens in Baltimore County with end-stage renal disease who require hemodialysis, who lack transportation to and from their dialysis center. The transportation will certainly reduce readmission rates to the hospital. It will reduce healthcare costs. It will keep the community patients out of the hospital. It will provide these kinds of service in an outpatient setting, which could inpatient settings could cost 3 times more than outpatient settings. Rather, inpatient dialysis at the hospital could be 3 times more in terms of cost than it would be if a person received dialysis as an outpatient. Rehospitalization in chronic kidney disease in 2017 increased. The lack of timely transport services for hemodialysis patients exacerbates these kidney diseases. The timely operated transportation services improved health outcomes in hemodialysis patients and reduced readmission rates. Poverty plays a significant role in accessing transportation. Baltimore County has a significant level of poverty. This transportation project will be extremely beneficial for Baltimore County residents and the community hospital in reducing readmission rates and also the frequency of missed dialysis treatments. Healthcare market provides transportation services through various private companies. Uber and Lyft and some ambulance companies are partnering with healthcare organizations to provide non-emergency transport services. Baltimore County is offering transport services through Transdev. Also, taxi cabs are involved in some of these non-emergency transport services that are covered in some cases with private insurance, and there are some also some partnerships that's going on in terms of Medicaid in some other states. Medicare doesn't offer a non-emergency transport service in and of itself at this point. There is an organization that's called Logisticare that's partnering with United Healthcare to offer these kinds of services. We do have some risk and some roadblocks. There's a lack of government supporting this particular project, and a lack of government funds for non-emergency transport or non-emergency transportations. Patients who get dialysis can have out-of-pocket costs when it comes to Uber and Lyft and taxi cabs, and some senior citizens don't have that kind of money, or some of them don't have the capacity to arrange these kinds of services. Some of them have a lack of family or caregiver support, and there are regulatory barriers in some of these health insurances that exclude non-emergency transport from their benefits. Our plan is to partner with Northwest Hospital. First Choice will partner with Northwest Hospital and DaVita Dialysis. We'll need trainees who are certified in CPR. We'll have to certify them in CPR. We'll have to get vehicle license and insurance as part of this project. This project plans to integrate its services with hemodialysis centers and the Northwest Hospital. We'll have to establish a transplant coordinator. We'll need office space. We'll need full-time employees. We'll also need part-time employees. We'll have to have full-time drivers. These drivers need to be CPR certified and first aid certified. There'll have to be orientation for new staff. First Choice will partner with Northwest Hospital. This will be a joint venture. Having a joint venture will achieve a common goal in keeping dialysis patients in the community and reduce readmission rates into the hospital. One of our challenges is we'll have to convince the hospital that this is necessary, that they want to partner with us. That means they'll be expanding their role in terms of inpatient and expanding their role to some outpatient services. We'll need we'll find additional challenges in hiring drivers with low labor cost and even finding volunteers. There will be some legal liability because patients can fall sometimes. There will be fall risk. Drivers will need additional training for getting patients in and out of the vehicles. And some of these staff may be injured when getting patients in and out of vehicles. And some of these senior citizens might have some difficulty in getting into the vehicles. And we'll have to hire additional caregivers for some patients that may mean that we need additional funds. Our market analysis shows that First Choice Transportation will provide these free services to roughly 2,500 patients in Baltimore County. We'll have 10 buses scattered or located about Baltimore County. The stakeholders for this kind of project will be the hemodialysis patients, hemodialysis centers, caregivers, healthcare providers. We'll also need government grants. We'll partner with Uber, Lyft, and health insurance, as well as the Medicaid program. When including seniors in this project, we realize that seniors often watch videos online. 94% of them are accessing the internet. The demographic for this particular project would be those senior citizens, and the particular marketing challenges we may face is the inconsistent execution of promotions and the lack of resources. In terms of estimating cost, the initial investment will be $1 million. We'll need 2 full-time employees. We'll also need part-time employees. Just to make a long story short, the First Choice budget will be roughly about $800,000, excluding overhead costs. Our internal stakeholders will be the philanthropy department at Northwest. We'll need grants. We will certainly have community outreach. We will coordinate with the American Kidney Foundation, the American Red Cross for financial support, and also we'll need volunteer drivers. Thank you, and I hope you can understand all of the things that we're proposing.